Dr. Santhi Vardhani, Yashoda Hospital, General Surgeon, Secunderabad branch. The patients feel it is constipation. Why constipation? The constipation is divided into many causes. It can be anal issues, it can be intestinal issues, it can be digestive issues, it can be motility issues. But today I am going to talk about anal issues with the constipation. Constipation patients, there is a feel of constipation. Urge will be there to let out the stool, and the sensation is also will be there, that nature call also will be there, but the motion won't come out. That is stucking feeling at the anal canal. That is mainly it is a problem related to the anus, anal canal and the rectum, which is causing the obstructive defecation syndrome, that is obstruction at the outlet. In the females mainly either with the post hysterectomy phase, because the organ which should be support at the anterior compartment, it is not there. So there will be the drooping of the intestine into the vaginal cavity and the obstruction and stasis of the stools at that level, and the angle cannot be straight and the motion cannot be passed. That is one of the problem. And the anal spasm is one of the problem, and the last one maybe it is intersusception. That means the anal canal and the rectum, both they will be tube in tube. It cannot be a long tube and it will be tube in tube. Then there is a stasis of the stool. Motion cannot come out. Nowadays, the obstructive defecation syndrome, that is constipation and ODS, there is a rampant rise of this problem. Because of this problem, if they reach over the surgeons and they reach over the gastroenterologists, sometimes we operate for the hemorrhoids and some anal fissures things. But even though with the surgery, there won't be a good result to the patient. Again, they will end up with the same problem within 1 to 1.5 years. The problem is not at the outlet of that sphincters. It is mainly the angulations. Anorectal angle is not happening in a straight way. The tube is not forming in a straight way. Then the stool will lodge in the upper compartment and it is a difficulty to descend into the anal canal and to come out. Mainly Indian sitting position is one of the good relieving factor this problem. That is Indian squatting position while passing the stool. That is universally worldwide accepted good position for the anorectal angle straightening. But nowadays, because of the arthritis and our lifestyle and all, we are not using the Indian commode. We are using the Western commodes, and patients cannot bend their knees and cannot even sit on the normal squatting positions. But if it is possible in the ODS patients, it is always better to have the Indian squatting position for passing the stool. And the second most thing is you have to keep one stool in front of the Western commode. By that your legs will be raised and the knee joints will be flexed and the hip joints will be flexed. By that the anorectal pipe will be straightened, the stool will pass out easily. So mainly the position, how you are sitting, and whatever the foods you are consuming, and the sleeping pattern, because the digestion mainly takes place while you are in the supine sleeping posture. So that is also mainly important. Even though you are taking lot of water, roughly around 4-5 liters also if you are consuming, the large intestine will get only 200 ml of the water after total reabsorption. So more quantity of water is required. So if you are going on taking more of water, then you feel nauseating. So don't try to venture only taking of water. Try to adjust the food with a more liquid component and softer structure than the harder structures, and try to change your lifestyle for the constipation. The constipation is big thing. We have to come into a conclusion where is the problem for that constipation. Then only we can treat. As a surgeons, we can treat wherever the problem is related to the constipation at the anal canal and the rectum. Being a surgeon and a proctologist, we can treat the problem of the anal canal and the rectum. If the digestion system is at failure, that means the motility, intestine is not moving. Mainly in hypothyroid patients, that is wherever the thyroid is a problem, the intestine also it will be lethargic. It won't move as a normal schedules. Have to be cautious always about the thyroid levels. Try to maintain the thyroid TSH roughly around 2 to 3 to get a better stool. So these are all we have to summative the things, and we have to come into a conclusion where is the problem and what is the solution for that. If you come to us, we can discuss about it. There is no need of going on seeing the literatures and searching and getting panic about the issues. There are a number of solutions for this problem. Please come and discuss. We are at Secunderabad Yashoda. Thank you.
Like, comment, and subscribe for more health updates.